Hello, my name is Megan Carrie, and I'm going to be talking about radiation protection. There's a lot of over-concerns about radiation in this field. People are concerned that X-ray produces cancer or that X-ray produces mutations. I mean, maybe, but we keep guidelines for safety. Today, we have a beautiful day. In this beautiful day, what people don't know is that you actually interact with more radiation that produces more damage than an X-ray. For example, on a nice day like this, many people will spend the day at the beach. Well, you will receive more radiation to your skin that will produce melanoma and more changes in your skin. So today in my presentation, I'm going to explain that X-ray really isn't as bad as people think. To clarify this, we do this for one main purpose, and the benefits really do outweigh the risks that we take when we do these procedures. The intentions of our work in our career is to produce diagnostic good images to help increase the possibility to live longer. Being exposed to this type of radiation, it produces more damage, believe it or not, than an X-ray. One of the things that is actually imperative for working in this environment in which ionizing radiation is present is how we protect ourselves. One of the consequences for receiving radiation in our whole body could be genetic defects or mutations. These mutations or genetic defects can be stochastic, in which they won't appear until years later because they need some elements that increase the sensitivity of the organs like the gonads, your skin, your thyroid, and specifically the lens of the eyes. Today I'm going to be presenting all these specific guidelines in order to minimize the amount of radiation that can be exposed when choosing this particular career. Not only for personal exposure, but also for the patients as well. One of the principal guidelines that we begin with is simple. It starts with 3 cardinal rules, and it is called ALARA, which stands for as low as reasonably achievable. The 3 cardinal rules for radiation are shielding, in which we use lead protection. Distance, the radiation we apply is the inverse square law. We established that increasing the distance of the source minimizes the amount of radiation towards you to the square of the distance. It's one of the best practices that we can use to protect us from radiation. And then the 3rd cardinal rule is time. What we do is we limit the time being exposed to the patient and ourselves as well. These principles are regulations to keep the minimal standards for radiation protection in order to keep us safe. In the X-ray room, there are some barriers, for example, the walls and the window. Their main components is lead. Why lead, you ask? Well, because it has a high atomic number, which increases the photoelectric absorption, which doesn't let the radiation go through. When we built the barriers, we had to take into consideration the space and the amount of X-rays we deliver, or how we are called the workload. It consists of how often, how many patients, the technical factors that we most likely use, and how many days the room is open and how many patients per day. So we take the average and multiply this number to establish the workload, MA minutes per week. Primary, secondary barriers. There are 2 different barriers built to protect us from ionizing radiation. The first one is primary barrier and the second one is secondary barrier. The primary barrier was built to try and protect people from the primary beam. Anything that will be exposed to the vicinity or next to, we needed to create a thickness so the radiation doesn't go through. The lead has to be a minimum thickness for the primary barriers 1/16, and it has to be from the floor up to at least 7 feet, which is normally where the X-ray tube lies. For the secondary barrier was built, which is the housing of the X-ray tube, to prevent it from leakage. Next, we're going to talk about collimation. If you look at figure A, you have more of a chance to get scatter or regular radiation of the primary beam towards the gonads. But when you collimate, like in figure B, there is no chance whatsoever. This is why we increase collimation. We can also apply this to the AP projection of the pelvis. Collimation is imperative to reduce the dose to the gonads. There are 3 different types of gonadal shielding. The first one is going to be the contour shield. It is the best one to protect the gonadal area for males. It has a contour shape, so it adapts to the curvature of our bodies. Next, we have the fig leaf. It's a flat contact tube used to protect the female gonadal area. And then lastly, we have the shadow shield, and that is mainly used for a sterilized field, basically for surgery. And then here you can see how the shadow shield is used mainly for surgery. Now I'm going to talk about fluoroscopy. Here I have a chart, our lead apron protection. So when you get a certain amount of kVp, this is a percentage that would come out when you're wearing a certain amount of lead. So when you have 75 kVp and you have, for example, gloves that are 0.5 lead in them, you would get protected 66%. But when you have 100 kVp wearing the gloves of 0.25% lead, you would get 51%. And so on and so forth. If you have a lead protection of 0.50, you would get 88% when you have 75 kVp, or 75% when you have 100 kVp. And then when you have 1 millimeter of lead on you protection, you would get 99% when you have 75 kVp, or it would go down to 94% when you get 100 kVp because of more penetrability. And then over here, I have the different doses of lead. So when your goggles that you have to wear in fluoroscopy are 0.35, your gloves and boots would be 0.25. And then your whole body dose of lead protection is a minimum of 0.50. Okay, and the whole body shielding includes your head, your neck, your trunk, knees up, elbows up, your gonads, of course, specifically. And then here I have the lead apron that you would normally wear, or a patient would wear, depending on, to protect you from the radiation. In fluoroscopy, on the side of the bed, there is a Bucky slot shield, which is also made of lead. The minimum requirement for this is 0.25 millimeters thickness of equivalent. Here you can see in fluoroscopy the amount of radiation you receive when you stand in different positions. The best one would be D. This is the intensifier tube, and standing behind it, you would receive the least amount of radiation. To conclude my presentation, natural radiation produces more radiation than X-rays, which in turn does more damage to the human body. And that's it for today, guys. I hope you learned something new today, and until next time.